Hello, welcome everyone. Welcome to Beyond the Basics. This is Hallie Cloud. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It is designed to provide training and resources to facilitate enrollment in health insurance marketplaces and Medicaid. We provide these resources for healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. Before we begin, we have our usual logistical items to run through. First off, the Center on Budget and Policy Priorities is a nonprofit policy organization, and it is not a part of the U.S. Department of Health and Human Services. This webinar series is also not intended for press purposes, and at this time, we're also not able to offer any continuing education credits for participating in the webinar. So sorry about that for anyone who is curious. As always, we are recording today's webinar, and afterwards we'll circulate the slides, a video recording of the presentation, and additional resources that we talk about. We post everything to our Beyond the Basics website at healthreformbeyondthebasics.org. The webinar video and the slides and everything should be posted by later tonight or tomorrow morning, and then we'll send everything out via email next week. I will also post a link to the PDF of the slides in the chat as soon as I'm done with the intro, so you can follow along as we present today. All of the participants are muted and in listen-only mode. You'll remain that way for the entirety of the webinar. So if you'd like to ask a question, please click on the Q&A icon in the control panel at the bottom of your webinar screen and type your question into that little box. We will monitor questions throughout the webinar and we'll pause a couple of times for Q&A. We will definitely not be able to answer every single question asked, but we will have a record of your questions and we incorporate that as much as possible into future presentations and resources. You also are welcome to email individual questions to beyondthebasics@cbpp.org to have your question answered individually. So for today, this is part 8 in our OE10 webinar series. Today we're going to bring together all of the policies that we've covered in this series so far by walking through in-depth examples of the application process. We also are very excited to go through the much anticipated fix to the family glitch. So that will also be a part of this presentation today. Today's presenters are Claire Heyison, a Senior Policy Analyst here at the Center for Health Insurance and Marketplace Policy, and Jenny Sullivan, who is the Director of Health Coverage Access here at the Center as well. So with that, I'm going to turn it over to Claire, and thank you again for being here, everyone.
Thanks, Hallie. Hi, everyone. So let's jump right into this first scenario. We've got the Castillo-Dawson family. Next slide. There are certain things we're going to focus on in this scenario. We're going to talk about automatic redetermination and renewal, changing plans, updating income, and data matching issues. So all issues that you might encounter after a person or family has enrolled in coverage for the first time. So in the Castillo-Dawson family, we've got Jill, Alicia, and Michael. They have no offers of coverage at work, and they're currently enrolled in 2022 coverage at healthcare.gov with a projected income at 279% of the federal poverty level. Next slide. Because they're enrolled in 2022 coverage, they get a notice from healthcare.gov about open enrollment, recommending that they update their household information. And this is what the notice will look like. It tells them that they should come in and update their information because if they don't, it could mean they won't get the right amount of financial help or they might owe money on their 2023 federal tax return. But the family is busy, they think that their income won't really change, and so they don't go back into the website to update the application. Next slide. And because they don't update their application or stop their policy, in mid-December, they're re-enrolled and receive several notices from the marketplace. They receive an eligibility determination notice, they receive an enrollment confirmation from their insurance carrier, and they get their first bill. So note that because the family has been automatically re-enrolled, their first bill is going to be a regular premium payment and not a binder payment. A binder payment is the first premium paid for a new policy. Because the family was re-enrolled into their existing health plan, their first payment for the 2023 coverage year will be a regular premium payment. And the key difference between the two is that if you don't pay the binder payment, you don't get coverage at all. You're axed out from day one. But if you miss a regular premium, you can fall into a grace period and have between 1 and 3 months to catch up on premiums without being terminated from coverage. So this is what their enrollment confirmation is going to look like. You can see that it states the amount of APTC that the family is eligible for, and we're going to talk about how the marketplace came to that number. Next slide. So as we've talked about in previous webinars, the marketplace uses several data points to update income if an applicant does not update their information before a new plan year. They'll use the updated federal poverty guidelines, they'll use the 2023 benchmark premium information, and they'll use the most recent income information available adjusted to 2023. In this case, the most recent income information available is going to be the family's 2022 projected income. So healthcare.gov is going to update their income by maintaining the FPL level of their 2022 projected income. In 2022, the family estimated their income at around $61,000, which was 279% of the federal poverty line. Healthcare.gov keeps the 279% of the federal poverty guidelines, but updates it for the new year, which means their adjusted income is going to go up to $64,253. And we have links to the current FPL guidelines and details on how the marketplace comes to these numbers linked at the bottom of the slide. Next slide. But once the Castillo-Dawsons have been re-enrolled in their plan, they realize they've made a mistake. Their son Michael has diabetes, and on January 10th, they realized that his pediatric endocrinologist is no longer part of their plan's network and one of his prescriptions might not be covered. So the plan doesn't really work for them anymore and they want to choose another one. They can do this because they're still within the open enrollment period, which ends on January 15th. They can choose a new plan even though they've been auto-enrolled and their coverage for the new plan year has started. On the right are some possible plans that they can choose to enroll in. And they can see that both of the United Healthcare Silver plans on the right will cover Michael's pediatric endocrinologist and his insulin. And just wanted to add a brief disclaimer that these medications may not be recommended for pediatric diabetes and are for example purposes only. So assuming that the Castillo-Dawsons paid their January premium, they have coverage in their re-enrolled plan for the month of January. And as a result, the earliest coverage date that this new plan can take effect is February 1st. And because this is a new plan, they need to pay that binder payment for February, otherwise their coverage won't start. Next slide. So they do pay the binder payment, the coverage starts. Then in April, Jill shifts from a full-time salary position to part-time hourly work, and she needs to update her income at healthcare.gov to see what that does to the family's eligibility determination. And here's what that screen looks like in healthcare.gov. Under what changes should I report, one of the options, that third bullet says your household income goes up or down like from a job or benefits, and that's exactly what's happened here. So Jill will go back into her application. She shouldn't do a new application. She'll go back into her existing application and report a life change. Next slide. So one of the questions you get on the application is to enter the current monthly income, and then after that you enter the annual income. So it will start out with Jill's prior income estimate displayed, and now she's going to update it. Remember that monthly income is used to make the Medicaid eligibility determination, so it's important to be accurate on this so they can get an accurate result. Jill's new income is going to be $566 per month, and so she enters that. Next slide. Now, healthcare.gov is going to assume that Jill's monthly wage applies for the full year, so they're going to take her monthly income that she just entered in and multiply it by 12. But in this case, that's not correct because she had already earned more income in the first few months of the year. So she'll use healthcare.gov's tools to help her do the math. In the blue call-out box on the right, there's an income calculator for people whose income is hard to predict or changes throughout the year. And on the next slide, we'll see what that looks like. So using that calculator, Jill will enter in her monthly income and it will calculate a result. She'll use that number to fill in the previous screen that asked for her annual income estimate. Next slide. Now there's another alternative, which is to use this annual income calculator, which you do not need to start an application to access. You can just use the link on the bottom of the slide. And using this calculator, you can enter each job that a person has along with each pay amount for different months. In this case, Jill can also add in her wife's annual income of $37,269, and it gives her a total of about $48,000, which is 210% of the federal poverty line. Next slide. All right, so Jill has reported her change in income, and because their 2023 income is much lower than anticipated, they discover that Michael may now be eligible for Medicaid. Michael's application will be transferred to the state Medicaid agency, so this is not a final decision. But in the meantime, while the state Medicaid agency works on confirming Michael's eligibility, the marketplace is going to assume that he's going to be Medicaid eligible and therefore not eligible for APTC going forward. But Jill and Alicia are still eligible to buy a marketplace plan. They still have significant premium tax credit and they're eligible for cost sharing reductions. Next slide. And here's what their eligibility determination notice, or EDN, says. Those of you who've been assisters or navigators during previous open enrollment periods may notice that this year's EDN looks a bit different. It was changed in March of last year. So right at the top now, the EDN states that the family is eligible for a premium tax credit of $815 based on their estimated annual income. Moving down to the chart, the EDN notes that all 3 family members applied for coverage and all 3 are eligible to enroll in a plan. And it has the date by which they must enroll in coverage, which in this case would be the end of the family's SEP. The EDN also states that only Jill and Alicia are eligible to receive premium tax credits and cost sharing reductions. And this is because, as is shown on the next line, Michael is likely to be eligible for Medicaid. In prior years, Jill and Alicia's change in income would likely have triggered a DMI or data matching issue, and the 2 would have needed to submit additional documentation to verify their income to receive a PTC. But starting in coverage year 2023, a person's income must be at least $12,000 lower than and less than 50% of their 2021 tax filing income in order to file a DMI or to trigger a DMI. And that 50% reduction in income can be a pretty high bar to clear. Now, recall that Jill and Alicia's projected income for 2022 was around $61,000. So while their new anticipated income for 2023 does meet that first condition of being more than $12,000 lower than that, it doesn't meet the second condition of being less than half of that amount. So they're earning $48,000. They thought they would earn $61,000. That is not less than half of what they thought their income would be. And because the change doesn't meet both conditions, the DMI is not triggered, and Jill and Alicia do not need to submit any additional documentation and can proceed with enrolling in the plan of their choice. And that's all for scenario 1. So let's move to scenario 2. We've got the Hernandez-Rosta family. Next slide. In this scenario, we're going to talk about determining who's in the household, determining income, understanding the impact of employer-sponsored insurance, or ESI, and understanding eligibility for APTC and Medicaid or CHIP. And we're also going to get into the new family glitch change. So in this family, we've got Hugo Hernandez, Elena Rosta, and their children, Javier and Maria Hernandez, and they all live together. Hugo and Elena are not married, and Elena usually claims both kids on her taxes. Hugo expects to earn around $38,000 this year, and Elena projects earning $30,000. They live in a state that has not expanded Medicaid, and Elena has offers of self-only and family employer-sponsored coverage. Next slide. So the first thing the application is going to do is ask a lot of questions about their specific relationships and their living situation. These can seem pretty excessive when you're going through all the screens, but essentially the application is asking these questions because of the complexity of tax dependency rules and Medicaid rules, and the application has a lot of that information built in and will help you along the way. Next slide. So next, the application asks, who will Elena claim as a dependent on their 2023 federal tax return? There are 2 ways people can be dependents. They can be qualifying children or they can be qualifying relatives. And here we've got the rules for qualifying children. The person must be a child or one of these other relationships. They have to be a US citizen or resident for tax purposes of the US, Canada, or Mexico. They must live with the tax filer for more than half of the year. They must be under the age of 19 or a different age under these different circumstances, and they can't be providing their own financial support. Elena does qualify to claim the kids as her dependents, but I want to note that Hugo would also qualify as well, and that's because if you go through all of these questions for Hugo, you can see that he'd meet all these criteria as well. But Hugo and Elena can't both claim the same dependent since they file taxes separately. And Elena's always claimed the kids on her taxes previously, so she puts that yes, she will continue to claim them again in 2023. Next slide. The next question on the application is, are Elena and Hugo married? And there's a cheat sheet here if you click on Learn More About Marital Status that tells us that if a person lives with their partner but is not married, they should select single on their application. So in this case, Elena and Hugo are both going to say that they're single. Next slide. Now let's talk a little bit about the tax filing requirement for APTC. To claim a premium tax credit, an enrollee needs to file a tax return, and that question is asked directly. Now for Medicaid, of course, tax filing is not necessary, so you can still complete the rest of the application even if you don't answer this question. You could still get to a result where the applicant could be found eligible for Medicaid if they meet all the other eligibility requirements, but you wouldn't see their eligibility for APTC. So Elena is asked if she'll file a federal tax return and who she'll claim, and as we've said previously, she will claim the kids as dependents. Next slide. Now the application asks for income information. It asks for income information for both Elena and Hugo. Elena's income is going to be from a job. There's a drop-down box there to select different kinds of income, and she has to give her employer's name. Hugo also lists his job income and gives his employer's name. Next slide. And now they're asked about employer-sponsored coverage. Elena is offered employer-sponsored coverage both for herself and her family. Note that this coverage does not include domestic partners. Some coverage does. In this case, it does not. So Elena's asked, will any people be offered health coverage through their job or through the job of another person like a spouse or parent? And in this case, Elena, Javier, and Maria are all being offered coverage through Elena's insurance. The next question is going to ask you about minimum value, and we talked about this a bit in a prior webinar. It's a complicated concept and one that people understandably gloss over. But basically an employer plan meets minimum value if it has an actuarial value of greater than 60%, which means that the plan covers at least 60% of the cost of expected medical claims for a standard population. So how on earth do you know if a plan meets that standard? The easiest answer is going to be that it's on the summary of benefits and coverage, which should be available from employers for every plan that's offered. The application does state that most job-based plans will meet minimum value, and that's definitely true. But if you have any kind of sense that maybe a person's employer-sponsored plan will not meet that standard, it's a skinny insurance plan, you can definitely have the applicant reach out to their employer's HR department or benefits administrator to get that summary of benefits and coverage, which will state whether the plan meets minimum value requirements. Next slide. So we've established that Elena's employer-sponsored plan meets those requirements. The second question about employer-sponsored insurance is whether it is considered affordable. So does the lowest cost plan offered by the person's employer cost less than or equal to 9.12% of the person's household income? If so, they can still purchase a plan through the marketplace, but they will not be eligible for APTC. Next slide. So many of you have definitely heard about this already, but there is going to be a big change in determining ESI affordability for 2023. Previously, APTC eligibility for an employee's family members was determined based on whether the employee's self-only coverage met the affordability threshold, even if family coverage did not meet this threshold. And this was called the family glitch because some families didn't qualify for APTCs, even though they also weren't offered affordable family coverage through an employer. So beginning in 2023, the APTC eligibility determination will be based on whether each family member has access to affordable employer-sponsored insurance, either through self-only coverage or family coverage. Next slide. So how will this work? The marketplace will assess 3 different questions for each household. The first question is, does the person have adequate, affordable, self-only employer-sponsored coverage? The second question asks whether the person's household members have access to employer-sponsored family coverage that meets the affordability and minimum value requirements. And this assessment will apply that 9.12% threshold to premiums for a family plan, not for a self-only plan. The third test will assess whether the person's household members have access to coverage that meets the affordability and minimum value requirements through a different employer. If a person does not have an offer of affordable, adequate coverage through an employer, whether it's through their own employer or through the employer of a household member, that person may now be eligible for APTCs. Next slide. So going back to our example, Elena earns $30,000 annually and her monthly premium is $100 for self-only coverage and $300 for family coverage. So first we'll look at the employee test. Is Elena's self-only plan affordable? And yes, it's affordable because it costs less than 9.12% of household income. So that means that Elena is not eligible for APTC because she has access to an affordable minimum value plan through her employer. The next question is whether the family plan is considered affordable. Family coverage for Elena and the kids is 12% of their income, which is above that 9.12% threshold. So Elena can still enroll in coverage that's considered affordable if she enrolls in her self-only plan, but the kids do not have access to an affordable family plan through ESI, so they are now eligible for APTC. Now note again that Hugo is not included in Elena's coverage offer, so he could be APTC eligible. The third question is whether the family has an offer of affordable, adequate coverage from another employer, and the answer to that is no. Hugo does not have an offer of ESI through his employer. Next slide. Now, to take a step back for a second, a question you might be asking is, why are Elena and the kids not eligible for Medicaid or CHIP? Because Elena's income is right around the federal poverty line for a family of 3. So remember that the family lives in a state that has not expanded Medicaid. In non-expansion states, the income eligibility threshold for an adult who is not disabled or pregnant is typically lower than the poverty line. The average for non-expansion states is around 41% FPL or $9,000 for a family of 3. And so Elena's income is still too high for her to qualify for Medicaid in her state. Medicaid eligibility for children is typically higher than it is for adults, even in non-expansion states. But Javier and Maria fall under one of the exceptions to the household and income rules because they're kids living with both parents who are unmarried. So both Hugo and Elena's incomes are counted when determining their eligibility. And when we combine Hugo and Elena's income, the household income is 245% FPL, so too high for the kids to be Medicaid eligible. Next slide. And here's the schematic we have on who's a tax filer, who's a tax dependent, and who is a non-filer non-dependent for Medicaid household and income purposes. And you can see that the kids fit into that middle column arrow as individuals under 19 and living with both parents who are not expected to file a joint return. And so the arrow goes to the third row, which says they're non-filer, non-dependents, and for individuals under 19, that would be, their household would be the individual plus their siblings plus their parents. And so for this household, Hugo is alone with a household size of 1. Elena has a household size of 3 because that's the rule for a tax filer. And the kids have a household size of 4 because both parents' incomes are counted. Next slide. Okay, so here's where we stand right now. Hugo is eligible for APTC, but not for CSR because his income is at 280% FPL for a household of 1. The kids are eligible for APTC and CSR, and Elena can enroll in self-only coverage through her employer or purchase a marketplace plan, but without any financial help. Finally, because there's more than one tax household on the application, the family is directed to call the marketplace call center to enroll in coverage rather than doing so online. But before they enroll in coverage, the family has some math to do. They have a few different options available, and it's worth considering which option is most affordable for them, especially since they could be paying monthly premiums for multiple different plans. This comparison will only look at premiums, but you could do a similar comparison using deductibles, out-of-pocket maximums, or other plan features. Next slide. So in scenario 1, Elena enrolls in her self-only employer-sponsored insurance, and Hugo and the kids enroll in marketplace plans. We know Elena's monthly premium is $100. Elena and Hugo select a marketplace plan for the kids that is less than their APTC amount, so they get $0 coverage. And Hugo finds a plan that costs $91 a month after factoring in his APTC. So in this scenario, the family's monthly premiums add up to $191 per month. Next slide. In scenario 2, all of the family members enroll in marketplace coverage. Elena's portion of the marketplace premium would cost $337 a month, and because she has an affordable ESI offer, she is not eligible for APTC. The kids stay enrolled in their $0 plan, and Hugo stays enrolled in his $91 plan, and then added together, the family ends up paying $428 a month for coverage in this scenario. Next slide. In scenario 3, Elena and the kids enroll in her employer-sponsored plan, which costs $300 a month, and Hugo enrolls in the $91 marketplace plan, and they end up owing $391 a month in premiums. So these are, again, all just different combinations of ESI and marketplace plans. Next slide. So it seems like scenario 1, where everyone is enrolled in a different plan, is actually the best option in this case. Next slide. But is there another option? We said at the start that Elena usually claims the kids on her taxes. Well, what if she didn't? What if Hugo claimed the kids on his taxes instead? So there's a general prohibition on giving tax advice to people, but you can talk about what the rules are. So for this family, you can talk about why Hugo is eligible for APTC and Elena is not. And you could mention that Hugo is eligible to claim the kids as dependents, and that might change their APTC amount. That being said, because this change could have other impacts on their taxes, the family should check with whoever helps prepare their taxes before making any changes. But for the purposes of this example, we're going to say like Hugo is completing the application to see what eligibility would look like if he claims the kids on his federal income tax return. Okay, next slide. And as we can see here, if Hugo does make this change, then all three of them become eligible for APTC and CSR, and they can enroll in a plan together. So let's see how this would impact the family's decision. Next slide. So now in scenario 4, Elena enrolls in her self-only employer coverage for $100 a month. And Hugo and the kids are able to enroll in a silver plan that is fully covered by their APTC amounts. So now we see that scenario 4, where Hugo claims the kids, is the most cost-effective for this family. Next slide. Now, as good as this result is, again, a prospective enrollee should probably contact whoever helps them with their taxes before making any changes, because switching who claims the kids as dependents could change other tax outcomes. So for example, this change could impact Elena's ability to qualify for an earned income tax credit or a child tax credit in ways that could be detrimental to her. But this is still a good option to put on the table to present to them because it could be consequential for them. So that wraps up scenario 2, and I think now we're going to pause for some questions.
All right, and you can type questions into the Q&A box. We already have a lot of questions, so I'm sorry ahead of time I won't be able to get through all of them, but we'll try to answer a few of them. One question that that was asked is if this information is valid for the state-based exchanges, and then to piggyback on that with the new family glitch fix, will that be available in state-based exchanges as well as healthcare.gov?
So yes, the family glitch fix applies to all marketplaces, the federally facilitated exchange, and then also state-based marketplaces. We've heard that HHS is, providing guidance to state-based exchanges to help them get up to date for the 2023 open enrollment. But also have heard that some states have pushed back on that and said that they're not sure if they're going to be ready. So it might vary by state. And yeah, we'll let you know if we hear anything more.
Thank you. And then another clarification on the family glitch fix. If both the husband and the wife in this example, or if both a husband and wife have an offer of coverage, or partners have an offer of coverage from their jobs, is there any kind of direction if one of the people doesn't want to take their own employer's coverage and wants to join their partner's plan? Essentially, what affordability test would you take would you take the test where she is on her partner's plan, that combined employer and spouse coverage, or just if they both have an offer of coverage, do they have to look at the affordability of that individual coverage offer from their employer? And let me know if you want me to repeat that. Sorry, that was a mouthful.
I think I get the question, and please let me know if this isn't quite what was being asked. But if I understand it correctly, the question is, if a person has an offer of affordable insurance through their spouse, affordable employer-sponsored insurance through their spouse, and let's say maybe they have ESI through their employer, but it's not affordable. Like, how is PTC eligibility determined if there's like one offer of ESI that's affordable and maybe one that's not? And again, so if you think back to the kind of 3 questions, does the individual have self-only coverage? Does the individual have family coverage? And is there another offer of ESI within the family? Those second 2 questions are going to be most relevant to this scenario. So if a person, eligibility for PTC is now being determined at the person level rather than just looking at affordability of the self-only plan. So if you're looking at the person and they have access to an affordable plan, either through their employer or through the employer of a family member, whether it's self-only coverage or family coverage, if it meets that affordability threshold of being equal to or less than 9.12% of their income, they are not going to be eligible for PTCs. I hope that helps answer the question.
Yes, thank you. And then we'll do one more question now, and then we'll do more questions at the end. This is sort of a clarification on this Hugo and Elena example, since they are not married. Does Hugo need to be listed on the marketplace application with Elena and the kids if Elena is claiming the kids as tax dependents?
Yes, absolutely. If they're living together, because the household determination for Medicaid is going to include Hugo's income. So he would need to be included on that application as well.
And then for Hugo's coverage, would he be a part of that application, or would he need to have his own application?
So again, for a scenario where you have different tax households applying for coverage together, the direction is just to contact the marketplace call center to help effectuate enrollment for plans for those different household members. So I believe that like the marketplace would have the information for both Hugo's household and Elena's household, and then would work to enroll both. So I don't believe that he would need to submit a separate application. Jenny, please feel free to jump in if you know otherwise.
Perfect. Thank you very much. And then we will continue on and then answer more questions at the end. So I believe I will turn it over to Jenny now.
Great. Thanks, Hallie, and thank you, Claire, for going through those examples. And we're really lucky that you were able to put this together so quickly after the rule came out earlier this week. So we're going to move on now to another scenario. We have 4 total, so we're halfway through. And this scenario with the Clemens family is going to include issues related to self-employment income, entering income, reporting tobacco use, plan selection, and APTC reconciliation. So here we have the Clemens family, Denise and Harold. Denise has self-employment earnings from her photography business, and Harold is retired, but he has a pension and Social Security benefits. And he also smokes, which of course is relevant for determining APTC, it's relevant for determining premiums. So to help these folks, the first thing you need to do is enter their income, or that they need to do. You need to advise them on how to do it. And unlike a household with straightforward income from an employer, we need to know a few things about how to count income to get started. So first, because we're dealing with self-employment income, we need to subtract Denise's business expenses from her total income to get her taxable income. So we will select self-employment income, and then we enter that net amount, her total income minus her business expenses, in the box. Now the application here is asking for monthly income first. So Denise says, oh, it's about $3,000. Okay. But then you might want to help her add up all her anticipated income and expenses to make sure that you have an accurate number. And if you need to help her out, we've got the self-employment income estimator tool here on our website. You can see the link at the bottom. You can't click on it now, but when you get a copy of the slides, you'll be able to. And we'll enter all of Denise's photography income for the year. She's got some weddings, a whole bunch of studio sessions, and these add up to about $33,000. And then we subtract her business expenses, things like advertising, insurance, travel to see clients, etc. And these expenses add up to $13,000. So we project her annual taxable income to be $20,000, the 33 minus the 13. Meanwhile, the application has taken that first figure entered for monthly income and multiplied it by 12. And now it's asking whether that's Denise's annual income. And now that we've done the worksheet, we know that that's an overestimate. So we say no. But then we also say no to the question about whether her income is hard to predict, because we actually have a pretty solid estimate of what her income is likely to be from the worksheet. So we enter $20,000 for her projected income. Next, the application needs to know Harold's monthly income. Now, both his Social Security benefits and his pension are taxable, so we enter each of these. And he doesn't have any other expenses that he can deduct, like student loan interest, for example. So the application automatically adds those two income sources together for a monthly income of $2,650. Then the application multiplies this by 12 to get the projected annual income. And both of these sources are very stable and predictable from month to month. So that estimate of $31,800 is an accurate projection of his annual income. So from there, we move on. Now we'll go through the rest of the application. We'll get an eligibility determination, and they do qualify for premium tax credits. So first they need to decide whether they want to take all of them in advance, some of them in advance, or none of them in advance. Most applicants take all of the credit in advance because it's advantageous for them, of course, to have to pay lower premiums from month to month. That's part of why the APTC exists in the first place. But consumers might know that something might change later, or they might be particularly risk averse and they prefer to take less than the whole thing. So they make that decision first. But then we get to the second question of reporting tobacco use. Now, you'll recall if you were with our earlier webinars, or if you've been doing this work for a while, that using any tobacco product, including e-cigarettes that have tobacco in them, for 4 times a week or more in the previous 6 months does count as tobacco use. Harold smokes, and he checks that box. The last time he smoked regularly was within the current month, and so he is counted as someone who uses tobacco for purposes of calculating his premium. As a reminder, insurers can charge up to 50% higher in premiums to people who use tobacco, and the premium tax credit is not increased to pick up the additional cost. That full cost falls directly to the enrollee. It's also worth noting that some states have outlawed tobacco surcharges. Those include California, New York, New Jersey, Massachusetts, Rhode Island, Vermont, and the District of Columbia. So here you can see the potential impact of tobacco surcharges on plans. These are sample plans from this year in Houston. And you can see for bronze, silver, and gold plans here offered by different plans, different issuers, the premium is much larger on the right-hand side if we've checked the box that the applicant is a tobacco user. And so premiums can be quite a bit higher, but you'll also notice that deductibles and out-of-pocket maximums stay the same. So it's only the premium that's being impacted by that tobacco surcharge. The rest of the features of the plan remain the same. So as an assister, one thing you can do is help people look for plans that don't charge higher premiums for tobacco use so that they understand that they have options. This may not be true in every market, but we can see that in this market, there is a carrier that is going to charge the same premium regardless of tobacco use. You can use the Compare Plans and Prices tool on healthcare.gov or the shopping tool on whatever marketplace is available in your estate to compare premiums for folks that use tobacco and don't, to do a little research in advance. This is some of the work that we talked about in previous webinars around plan comparison strategies, so that you can be prepared and understand which plans do and don't have a tobacco surcharge. And we do have a list of links to all state-based marketplaces shopping tools. Sometimes they're hard to find. So we have those links available on our website if you need them. And we are in the middle of October, so we should be seeing plans in just a few weeks. So now Denise and Harold are almost to the plan selection stage. But before they can look at plans and prices, they need to decide whether to be in the same coverage group or separate groups. Now you can break households into separate coverage groups on the marketplace if different people want different plans. Unlike employer coverage, where people are lumped together and maybe they get a special rate for the family that's different than if it was, it's not just double or triple or however many people are in the household, higher than what it would cost for just one person. In the marketplace, each person's premium is determined individually. So you can break people into different groups and they can choose different plans on the marketplace if that is something that they're interested in. Okay, now before we let Denise and Harold go, one more thing, we want to make sure that they understand that they have to reconcile their APTCs when they file their 2023 taxes. And if they got more help than they're ultimately determined eligible to have received, then they may have to pay some or all of that back. This is just a screenshot of Form 8962 that's used to reconcile APTCs. This is last year's form, but this year's form is forthcoming soon, and we expect it to look pretty similar. So we often get asked about repayment limits. So just to touch on those briefly, people with low incomes do have some safe harbors to protect them from owing back large sums when they reconcile APTCs. There are 3 bands for people with income below 400% of poverty, and there's a special safe harbor for people whose income is ultimately found to be below 100% of poverty. They do not have to pay back APTCs at all. But there's no limit to repayment if people's income is greater than 400% of poverty. However, now that subsidies are available to people with income over 400%, this does provide a bit of extra cushion, and I will walk through what I mean by that now. So let's say Denise and Harold had some income changes during the year that they didn't anticipate when they first applied. First, they needed a new roof, so they took $11,600 out of an IRA to pay for that. Now, despite the fact that this was money that they withdrew and spent, it does count toward their taxable income. Denise also earned more money and had fewer expenses than she expected with her business, so her self-employment earnings were actually $34,000 instead of $20,000. So their income is $25,600 higher than they projected on the application. It's a big jump, and they didn't report these changes during the year. So when they reconcile their APTCs, they learn that although they got $7,504 in APTCs, they were only ultimately eligible for $3,681 since their income went up to 423% of the poverty level. Now, people with income over 400% have to repay the full difference between what they were eligible to receive and what they got. So in Harold and Denise's case, this comes out to $3,823. Now, that's nothing to laugh at. That's a large chunk of money. But if the subsidies hadn't been available to people over 400%, then they would have been on the hook for the full $7,504 that they received. So they also could have avoided this conundrum altogether if they had reported their changes in income to the marketplace throughout the year. Then the marketplace would have adjusted their APTCs so that they wouldn't have owed back as much or potentially at all, depending on how precise they were able to be. But that's not always avoidable. And so just want folks to understand that there are some built-in protections with the more generous PTC. Okay, now we're going to move on to our very last scenario for today, the Alarcon family. Okay, in this example, I'll go over special enrollment periods, what counts as minimum essential coverage, projecting income, and how to help someone transitioning from marketplace coverage to Medicare. So here we have the Alarcon family, Vicente and Pilar, who are married and filed jointly. Pilar was employed for the first half of the year and made $24,000 at her job between January and June, but she was laid off at the end of June. So she's now getting $1,600 a month in unemployment benefits. Vicente has a part-time job earning about $16,000 a year and is becoming eligible for Medicare next year. So the relevant issues that come into play in this scenario are special enrollment periods, what to do about Pilar's COBRA offer from her job that she was laid off from, how the family is going to project their income for 2023, and what's important to keep in mind when Vicente qualifies for Medicare next year. So first, Pilar and Vicente get introduced to marketplace coverage when Pilar learns she's losing her job. Since they will both lose the employer-sponsored coverage they got through her job, they start researching their options. Maybe they talk to an assistant, maybe they talk with one of you. Employer coverage, they learn, counts as a minimum essential coverage, so losing that coverage qualifies them for a special enrollment period. And they happen to know that the date that Pilar's job is ending, she's being laid off, so they apply in advance to the marketplace. Now, with the loss of minimum essential coverage, SEP, people can get that 60 days before or after the loss of coverage. So because they know in advance, they're able to apply and select the date for their coverage to start. They learn at that time that they qualify for an APTC. They choose a plan in June, and they're able to start marketplace coverage effective July 1st. Now, because they did all this advanced planning, they had a smooth transition from their employer-sponsored coverage to marketplace coverage with no disruptions. This is rare, but that's why this is a sample scenario. Now, they also had an offer of COBRA from Pilar's former employer, but as COBRA typically is, it was very expensive. Again, because they were doing such a good job of planning in advance, they compared their options, chose not to enroll in COBRA, and chose the marketplace instead. But if they had enrolled in COBRA, they would no longer have qualified for marketplace coverage. They would have had to wait until the open enrollment period to switch to marketplace coverage for 2023, unless their COBRA ran out before then, in which case they would qualify for a special enrollment period at that time. Now, they've also got another coverage transition on the horizon with Vicente's 65th birthday coming up in April 2023. And at that time, he'll be eligible for premium-free Medicare Part A. So if he gets EPTCs while he's eligible for Medicare, he might have to pay those back, or he would have to pay those back. So we'll talk more about that transition in a moment. But just to talk a little bit more about when minimum essential coverage, what counts as minimum essential coverage. In order to qualify for an APTC, a person can't be eligible for or enrolled in other MEC, but the rules depend on what kind of MEC we're talking about. So even being eligible for Medicare Part A, even if the person has not completed enrollment, that makes them ineligible for APTCs. Now, having an offer of COBRA isn't a problem in the same way, but if the person, as I said, actually enrolls in it, then they are not eligible. That does count as minimum essential coverage. Involuntarily dropping COBRA does not qualify someone for a new special enrollment period. So now let's talk about their household and income. Household size is easy. They're married and they're filing jointly, so they're a household of 2. For income, let's first look at the income when they applied for coverage during their SEP in 2022. At that time, they had income from Pilar's job, plus her estimate or her anticipated unemployment income, which is taxable. So we do need to count it as part of their MAGI, their modified adjusted gross income. And then we add Vicente's income from his job. So this gives them an annual income of $49,600, which is 285% of poverty for a household of 2. And this is based on the 2021 federal poverty levels because it was a determination made for 2022 coverage. So they are likely eligible for a premium tax credit. Now, to project their income for 2023, Pilar assumes that she's going to get another job. She is looking, of course, although she doesn't think she's going to get one that pays as much as the one that she lost. She thinks she'll make about $18,000 and Vicente's income is going to stay the same at $16,000. So with a household of 2 and a total income of $34,000, that puts them at 186% of poverty. So they should qualify for both a premium tax credit and cost sharing reductions in 2023 with that lower income. Now, you might remember that an income drop can trigger a data matching issue. So let's look at how much their income dropped. When they renew their coverage for 2023 and update their income, the marketplace will compare that amount, $34,000, to their most recent 2022 projected income, $49,600. And the difference, $15,600, is more than the $12,000 threshold, but still less than a 50% drop in their total household income. So it will not trigger a data matching issue. Now, in years past, when we had a narrower threshold that people could slide by on without triggering a DMI, a change of this magnitude would have triggered a data matching issue, in which case they would have had to either provide an explanation or other documentation to the marketplace about why their income dropped in order to continue APTCs and CSRs in this case. Okay, last but not least, we need to help Pilar and Vicente prepare for Vicente's transition to Medicare when he turns 65 in April. When he becomes eligible for Medicare Part A, he's no longer eligible for APTCs. APTC eligibility ends the 4th full month after a person becomes eligible for premium-free Medicare Part A. So if Vicente doesn't cancel his APTCs before then, he'll owe back any additional APTCs he receives after that date. So the household needs to report that change. And of course, they want to cancel his marketplace coverage altogether since he'll be getting Medicare. But Pilar needs to keep her marketplace plan. She's not eligible for Medicare at this time. So to do that, they're going to want to call the marketplace call center and tell them the day that they want Vicente's marketplace coverage to end. This should be the day before his Medicare coverage begins. The call center can also help them designate Pilar as the new household contact for the marketplace. They should not just go online and try to do this on their own at healthcare.gov. It's really important because the termination date may be incorrect. and they won't be able to change the key contact for the household either. Now, if they did do this, they were ambitious and they were online and they thought they could get it done, they can always ask the call center afterwards to go through casework to adjust the date. But that's a lot of hassle, and it's really better to avoid this altogether and just plan to call the call center when it's time to switch. So to recap, Pilar and Vicente got a special enrollment period to enroll in marketplace coverage when Pilar lost her job. Because they knew about the loss of coverage in advance, they applied and chose a plan, so they never had a gap in coverage. Pilar was offered COBRA, but didn't take it, so they qualified for APTCs. And they come back to the marketplace during open enrollment and update their income for 2023. At that time, they learned that they now qualify for APTCs and CSRs. And they also set a calendar reminder to call the call center and cancel Vicente's marketplace coverage on April 30th, the day before his Medicare coverage takes effect. This helps them avoid having to pay back APTCs, and Pilar can keep her her marketplace coverage. Excuse me. With that, we have come to the end of the scenarios. And before I turn it back over to Hallie for Q&A, I just wanted to tell our audience, I think many of you have been on multiple webinars, and this is our last webinar for this year's series in English. I just wanted to send a big thanks to, especially to Hallie, who stepped in to moderate these and provide lots of other project support over the last several months. Incredibly helpful and appreciated, and just a huge thank you out into the ether for all of our presenters, both center staff and guest presenters as well. And then a shout out that if any of you or your sister partners help people who speak Spanish and provide assistance in Spanish, we have a special first time ever webinar next Thursday at the same time at 2 p.m. Eastern that will be delivered entirely in Spanish. I got to hear the dry run of that earlier this week, and it's pretty great. So we're excited to share that with you next week. With that, I'm going to turn it back over to Hallie to take us through Q&A.
Perfect. Thank you. And yeah, I just want to echo thank you to all of you. I know this is really dense material. So also a sort of preview. I know that there's a lot of questions around the family glitch fix, and we are working on an FAQs specifically about the new rules that will have a lot more details about the changes. So be on the lookout for that, and we'll make sure to send it to all of you guys too. One question on the example that you just went through with Pilar, in the last scenario, does Pilar get a special enrollment period after Vicente enrolls in Medicare since they had a life change?
Good question. So because there wasn't, Pilar is keeping her marketplace coverage, she is still eligible, and there haven't been any other changes in their household or income, they actually there is no special enrollment period at that time. But if they failed to cancel Vicente's APTC before the end of his Medicare initial enrollment period, then they wouldn't be auto-enrolled for 2024. The marketplace would say, nope, we're going to flag this case because this person is eligible for Medicare. They can't keep coverage into the new year. And at that time, Pilar would lose her marketplace plan, but that would trigger or qualify her for a special enrollment period to get back into the marketplace.
Perfect. Thank you. This is also special enrollment period related. What happens if an employer-sponsored plan changes their rates in the middle of the year, and it would affect PTC eligibility?
If there's a change in the offer that somebody has, then they should report that to the marketplace. And whenever you report a change, that the questions that are asked, you basically have to go through the entire application again, but in answering all of those questions, they would discover whether you would be eligible for an SEP or not. And they certainly would if you would be newly eligible based on a change in your employer coverage.
And then another question on the affordability test for an offer from an employer. If you're looking at a married couple with children, would the affordability test for the spouse, would that always use the family premium amount, or would it use the amount that would just cover the two spouses and not the kids? So if you have one spouse has an offer that covers the spouse, and then another offer that covers the spouse and the kids, are you looking at the affordability of just family coverage in general, or are you looking at the coverage that would just cover the other spouse? let me know if you need clarification on that too.
Claire, do you want to take this one?
Sorry, I didn't quite get that.
That's fine. I'll ask it again. Okay, so for the employer affordability test, and this might be one that we can answer in our FAQs because it's a little complicated. If you have a married couple with children, let's say the husband has an offer of coverage through his employer, and the offer covers, there's two options. There's a coverage that covers just the spouse, and there's another offer that covers the spouse and the children. For the spouse, are you looking at affordability of the entire family coverage or just the offer of coverage that would cover her and her husband if there are multiple offers?
So I'd want to get back to the question asker on that, but my understanding is again that the determination is made based on whether the individual has any offer of affordable coverage. So I believe if either of those coverage options, either the spouse only one or the spouse independence option meets the affordability test, then they would be ineligible for APTC.
Perfect, thank you. And then I know we have a lot of questions. I'm going to go through just a couple more. So if your question does not get answered and you really need an answer to it, please email us at beyondthebasics@cbpp.org and we can answer things individually. What question do we next? Let's say that the marketplace automatically updates a person's income, but the number is wrong. It's not actually what that person's income is for the next year. Would that person still need to repay any premium tax credits at the end of the year if they didn't go back in and update their application?
I can start here, and Claire, feel free to chime in. So the reconciliation process is going to be based on the person's income as it was reported on their taxes. But if they were receiving more APTC because they didn't update their income the prior year during the annual open enrollment period, and they did receive more APTCs than ultimately they were eligible for, then the regular repayment rules would apply.
Awesome, thank you. And then we'll do one last question, just a clarifying question to piggyback on our first Q&A. When we have a family house, a household of unmarried parents, and both partners are on the application so you put both partners on the application, even though they're not in the same tax household. And we talked about that happens because for Medicaid determination for the children, you need to look at both parents. But for the parents themselves, their income would still be separate, correct? If they are not married, even if they are living together. So kind of a clarifying question. And I think that one's for Claire.
Yeah, so if you, and you don't have to flip back to this slide, but if you're looking at the slides later, you can flip back to slide number 28 and it will say for the example with Hugo and Elena, that for the kids, they have a household of 4 because as non-filer, as non-filer non-dependents, they end up having a tax household of their parents plus their siblings. But for the individual tax filer who is not claiming the kids, so that would be Hugo in the example, his household size for Medicaid is going to be 1. And then the parent who is claiming the children their household size will be themselves and both children, but not their domestic partner.
Perfect, thank you. And I think we will, we're at the top of the hour, so we'll bring this to a close. Again, you all have just phenomenal questions every time, and we're sorry that we can't answer all of them, but they're really great questions. And again, this is part 8 in our series, so definitely go back to other parts of this webinar series for questions. We go through a lot of material over this 9-part series. So all of those are posted on our website at healthreformbeyondthebasics.org. You can watch all of our past videos, look at our slide decks and resources. We have our very exciting upcoming webinar next week that will be entirely in Spanish. That will be at 2 p.m. Eastern on October 20th. Please come to that. Again, we are recording today's webinar, and so we will post the recording, a link to the slides, and links to all the resources that we talk about, as well as links to the other webinars in this series. That should be up either later today or tomorrow morning, and we'll send it out via email next week. Huge thank you to our presenters today and to all of you for coming. And with that, I think we will bring this to a close. Thank you so much again, everyone.